Hello everyone, my name is Roshi Albi and I am currently pursuing nursing. While my presentation may not focus on traditional hospital nursing, I want to encourage you all to broaden your perspective on the many career opportunities available in this field. Nursing isn't limited to working in hospitals. There are other incredible pathways that offer better hours, competitive. I appreciate this today. What is the profession? Tell me about your role in this organization and how you started about this career.
Well, I am the CEO of Eldorado Community Health Centers. We are a federally qualified health center, so we're part of the nation's largest primary care network. We're sometimes referred to as the safety net, where we take care of everybody who doesn't have the opportunity to receive care in other places. We provide primary care, dental, behavioral health, optometry, psychiatry, podiatry, chiropractic. We try to provide as many services as we can in our clinics, because if we can't provide it, many of the people that we serve, most of whom are low income, make less than 200% of the federal poverty level. If we can't provide services to them, they oftentimes can't receive those services elsewhere. So I got into this career. I was going to graduate school and business school and trying to figure out what to do with my life, and decided that healthcare was a good pathway. And so I started my career in a hospital system where I was running some primary care clinics as part of an integrated healthcare system. And that was a great experience, but one of the challenges that regular healthcare organizations have is the payment model in healthcare. And so for the clinics I was managing, we weren't able to accept many low-income people that were on Medicaid insurance, because the Medicaid program just doesn't reimburse physician offices very well. And so whenever somebody that was on Medicaid called our clinic to establish care, we would have to send them to the local federally qualified health center. And so that was my exposure, my first exposure to the FQHC world, the community health center world. And I decided that that's where I wanted to be, because I didn't want to keep sending people away that needed care just because they didn't have the right kind of insurance. So I got a job here in California at a local FQHC down in Bakersfield, California, and then from there worked my way up to Sacramento, where we are now in the Placerville area. I will just say, as a plug for all of you going through school, the federally qualified health center world, the community health world, is really rewarding, and you really get to make a huge difference in the lives of the people that you serve.
Thank you so much for that. So what are the typical work week hours, and what shifts are work? How much vacation time does one get? Is it paid?
Yeah, so as CEO or somebody in senior leadership at an organization like this, your job is very fluctuating. Some weeks I may work 50 or 60 hours. Some weeks I may work less than 40 hours, depending on what's going on. I need to be available when people need me, and so that varies from week to week. But it's a flexible schedule, and so going into healthcare leadership is definitely rewarding from a lot of different standpoints. From a PTO standpoint, we get a fair amount of vacation time, just like the rest of our staff, and
Yes,
I get the same vacation amount that Roshi or anybody else in the organization gets.
Oh, perfect. Thank you. What are the typical job responsibilities, and what are the 3 personality characteristics that are necessary for this profession? And describe what typical contact with a patient for this profession.
Well, typical day varies for somebody like me. I'm responsible for making sure that everything in the health center is going well. So that starts with health center operations, patients coming into visits to see their doctor or dentist or other healthcare professional. But also we have the billing side of what we do, the HR side of what we do, the compliance side of what we do. And so all of those leaders report up to me, and I have to make sure that we're meeting the key performance indicators of the organization.
Hello, please welcome Dr. Hani Chabo, our Chief Clinical Wellness Officer, a leader in innovative health strategies. Dr. Chabo is dedicated to enhancing well-being through evidence-based approaches. We're excited to hear his insights today. Dr. Chabo?
Thank you, Rochelle. Hello, I'm Hani, aka Dr. Chabo. Nice to meet you all. I'm the Chief Clinical and Wellness Officer here, so I do a mix of looking at clinical quality and services and outcomes for patients, as well as well-being at the organizational level for our staff, how staff are functioning with each other, and then also promoting resilience among our staff through well-being strategies. I am a family doctor. I'm also board certified in addiction medicine and integrative medicine. And to answer a little bit about how I got into my profession and the education I received, I went through the typical track of any doctor, going through a Bachelor of Biology and then medical school, and then I did a residency in family medicine for 3 years. After that, I did another residency for 2 years in integrative medicine, and then I pursued some post-training education in addiction medicine through fellowships at the University of California in Irvine, who have primary care fellowships and psychiatry and addiction medicine. So I went ahead and did those over 2 years, and then I got board certified in addiction medicine. In my journey, I've gone through being traditional doctor, doing clinical care full-time, and then I found myself becoming a medical director of well-being because I was doing well-being education in our educational forums. And so I was approached by my previous boss, who offered me to be medical director of well-being and developed me into the role. So sent me to do trainings to learn what a medical director of well-being does. So I did a training with Stanford and another one with the American Academy of Family Physicians. Those were over the courses of a year and a half to learn to be a leader and to learn project management strategies and what well-being work is about. And so I did those, and I was medical director of well-being for 4 years at my previous organization, which got recognized by the American Medical Association and a program called the Joy in Medicine program that awards healthcare organizations that do system-level improvements for well-being. So we looked at things like how teams work together and practice efficiency metrics and culture-related metrics related to leadership and how effective leadership is being in teams, and worked on things like performance improvement and had cyclical projects that were happening every quarter in terms of what we wanted to improve. And then looked at also how we promote